Good evening, Dr. Parmar. First of all, my apologies for the delayed start. There was some problem with the Facebook streaming and it is not connecting. And so we have tried to send out the link to everybody. If there's anybody who's trying to watch us through Facebook, please follow the Zoom link, which we've already shared there. Just in short, I'm a cancer survivor and it's been 27 years now, and we set up this organization, We Care Foundation, to help out cancer patients in every possible way, whether it was financial way, whether it was information, whether it was guidance. And in the last lockdown period, we've had more than 14 such seminars and information talks, where for each one there have been more than 50 to 60 people who have attended. So we've been able to reach out to a large number of people. Today is exceptional, first time that this is not happening. So once again, I apologize for that. Today we have with us Dr. Vani Parmar. Dr. Vani Parmar, I'm sure most of you know, is an excellent doctor for breast cancer. She was in Tata Memorial all these years, and of late she has moved to Attract. So now she is working there, and she's an oncoplastic breast cancer surgeon, and special interest in conservative breast surgeries and breast reconstruction. She's a member of various committees involved in forming treatment guidelines, conducting multi-center clinical trials under National Cancer Grid, and has various publications and book chapters in breast cancer management. I can go on and on, but as it is, we've spent some time in trying to fix up this problem. So all that I like to say is, she has various varied interests, ranging from breast cancer surgeries to adventure sports. So maybe we'll have a special session by her on adventure sports, which she enjoys and she's extremely good at. So Dr. Parmar, all yours now.
Thank you so much, Vandana ji. I have to say thank you to We Care, and thank you so much for having got me over for this chat on breast cancer. The right time, October, Breast Cancer Awareness Month, and this is the right time to get aware of breast cancer as well. I have to appreciate the work that We Care has done in the field of cancer, supporting so many patients, and I really, really thank you so much for the help that you've also given to breast cancer patients as well. Thank you.
Thank you. So, Dr. Parmar, the first question that I would like to ask you is, what is the current status of breast cancer in India, and why is it so important to be aware of it?
Breast cancer in India is actually on a rise, but it's not alarmingly there for us to start panicking about it. If you look at the incidence in breast cancer in India, it's about 164,000 100,000 patients per year that you see as new cases. But the incidence is much more in the older women, and in India, in fact, you find some of the women are also younger, and that's because 80% of our population is comprising of younger women. The incidence, if you look at in the urban areas, is higher. Incidence is about 30 to 35 per 100,000 women. Now, I'm not going to bore you with the numbers, but it's interesting to know that this incidence is lower in the rural women. It's only about 10 per 100,000 women. The difference obviously shows that there is some role of urbanization, which plays an important role in breast cancer incidence going up. And that's very well evidenced by the fact that in US, UK, and in the Western world, you find in the developing world, you find that the incidence is as high as 90 to 100 per 100,000. That gives you a clear indication that there is something that happens with urbanization of women that increases the risk for breast cancer.
So you would say that in comparison to USA, we are safer?
Well, it appears so, and in fact, it's probably better off that we are in India than we are in US. So as you can see, technology has failed us even in starting this program. So technology and advancement is not really the answer when you look at cancers. In fact, as one moves towards an urbanization and all the impact that it has on the lifestyle, it seems to be actually increasing risks for certain cancers, and breast cancer is also one of those cancers which is impacted by this.
So rightly said. So who should be on the lookout for early signs of breast cancer, and what are the early signs of breast cancer?
Who should be on the lookout is a very important thing, because as we clearly see, even though one would believe that breast cancer is something that's inherited, interestingly, only about 5, maximum 10% of women actually have a history of breast cancer in their family. Majority of them would have other causes. And when I talk about other causes, most of these causes are modifiable risk factors. And when I say modifiable, they are actually under our control, but we don't realize it. But quite a few are not related to modifiable, so they are hormone related. And it's very well evidenced by the fact that older the women, higher the risk of breast cancer. So in India, as I've said, even younger women do get breast cancer, and that's because our population is younger. At the same time, if there is an early start of menarche, that means starting of periods, or a late menopause, the longer the duration that a woman menstruates, in fact, there is a higher risk for breast cancer. The impact of ovarian hormones is very well known, and this is evidenced by the fact that those who take hormone replacement therapy seem to be at a higher risk. So there is a huge evidence which says that most of breast cancer is actually influenced by hormonal levels in the body. But the modifiable risk factor is what we have to see. These are the ones that we can control. And when I talk of modifiable risk factors, first and foremost comes in obesity. So higher the body weight, higher the body mass index, higher the risk for breast cancer. So as far as possible, physical exercise should be incorporated as part of your lifestyle. Losing weight is very important for reducing risk for cancer. And this happens even for those who have a family history of cancer.
Okay. So when should one start being aware and checking oneself?
Starting being aware is, I would say, today, now. This is where we start. That means we have to understand ourselves, understand our normal, and it is very important to know one's own normal to be able to detect cancer early. So it is never a right time or a wrong time. I think being aware of your own self is very important. For younger women, it's easier for them to check themselves and find out if there is an abnormal change in the breast. But for older women above the age of 50, being aware of one's own normal is very important. But in addition to that, doing a clinical examination, getting a clinical examination with a physician or a clinician is important to understand what is normal. And a mammogram is supposed to be helpful above the age of 50. Understanding the signs of breast cancer is also important. What is it that is normal and what is not? So any change in the skin appearance of the breast, any discharge from the nipple, or if there is a swelling or redness of the breast, all of these require to be checked by a doctor. It is better to get oneself examined, even if there is a small lump which is not hurting, not really causing any pain. It's better to always get them checked, because most of breast cancers are painless lumps. So it is important to understand these signs. And if there is a family history, somebody in the family having breast cancer, the age at which to start, I would say, would be about 5 years before the member actually got breast cancer. And in younger women, 30 probably would be the right time when they start checking themselves. And this means a self-examination.
Dr. Parmar, I think there are some people who are saying they can't hear, so maybe you might have to speak a little louder.
All right.
Okay. Just now you were talking about, if the family member has breast cancer, then the checking has to be done earlier. So does it mean that it is sure to affect another daughter or the other member of the family? Should the daughters be worried if the mother has breast cancer? Or the immediate family, who would be considered as an immediate family to have breast cancer?
So if there is one member of the family who has cancer. Now let's understand this. If the person who's developed cancer is an elderly woman, say a 70-year-old, she probably has had the risk which is not related to a family history. In that situation, being aware of your own normal and presenting to the doctor when you have some symptom in the breast is good enough. But if the member who's affected is actually a young person, say at the age of 30 or 35, in such a situation, there is a possibility that there is a risk in the family which is genetic, and hence at a young age she has developed breast cancer. It's unusual for younger women to develop breast cancer. Cancer is usually a disease of the older age group. So younger women getting breast cancer could be related to a genetic risk, and that is where the other members have to be alert. Now, if there were two members in the family who had breast cancer, the risk goes even higher. Possibility of it being a genetic could be very high. Or if there is somebody who has an ovarian cancer and a breast cancer. Now, in that situation, this is called as a breast ovarian cancer syndrome. So, two members, one having a breast cancer, the other having ovarian cancer, could be actually indicative of a genetic risk. Or, interestingly, if there is a male member who has breast cancer. So one has to understand that even males can develop breast cancer. It's not just a disease of women, though it's a very, very low incidence. But even a male member can, and especially so if there is a hereditary risk or a genetic risk.
Okay. So, which means that in case there's a male member, we must definitely be sure about having others checked out. And if there's ovarian cancer and breast cancer in the family, then that needs to be further probed to find out genetically if there's some problem in the family and all that. But while we're talking of genetics, suppose there's some lady who had breast cancer and who passed away, and then her daughter has breast cancer. So will this be considered genetic, or it's one of the cases, or whether one should go in for genetic testing in such cases?
So if mother had breast cancer and she has passed away of breast cancer, now her daughter has developed breast cancer, it suggests two members, first degree relatives, two members having breast cancer. The possibility of being a genetic is very high. But remember that this can still be a chance. So to get evaluated for the genetic risk, which is a simple blood test which is done, is important to find out if there is an inherent genetic risk which is there as a mutation, genetic mutation. So that needs to be checked. But it could still be a chance. But it is important in such situation, since only the daughter is currently developed breast cancer, she should be screened. And in addition, any other female relative in the form of, say, her sister or a cousin. So first her sister would be checked. And if her sister also has, then I think a family tree to be mapped, and then understanding who else may be at risk is very important. So the usual lineage is on the maternal side. That means mother, mother's sister or maternal aunt, maternal cousins. That is where the inheritance usually happens.
There's somebody who's put a question. Can I take questions in between, Dr. Parmar?
Absolutely, absolutely. Yes.
My maternal aunt died of advanced breast cancer at the age of 62. Can it happen to me?
Maternal aunt died of breast cancer at the age of 62. Now here, as it's clearly understood, she's got age that's playing against her. So her maternal aunt was elderly. She was above 60 when she developed breast cancer. Whether or not she has the risk, it may not be a familial risk because her own mother or sister or daughter doesn't have breast cancer. But she should be aware that she has the same risk as the general population. Now, if that is the case, only being aware of self is more than it would be required that she checks herself routinely, and it is more than enough to be aware of cancer and to have a self-examination. But this is not an indication that this is a familial risk. But if a second member somewhere down develops either ovarian or a breast cancer, then probably there is a genetic risk. So one member, a second degree, one single member does not increase risk for breast cancer.
So what would you suggest is the best modality for breast cancer checking?
The most important, I put it as being aware. So self-awareness is the most foremost in picking up cancers. Because if there is a lump, sitting over it does not help. It's better to get it examined. The evidence currently says that above the age of 50, that's after attaining menopause or maybe 50 or 55 or whatever age, mammograms help in picking up cancer. And these are done at every year and a half, 2 years intervals, not earlier than that. But for younger women, mammograms have not proven to be that beneficial. So it is better to do a self-examination or at least a 6-monthly clinical examination by a breast surgeon or by a gynecologist or a family physician would be more than enough. But being aware is probably the first and foremost important thing that needs to be followed.
So is there a difference in the type of lump that is there in breast cancer and, like the fatty tissues which get deposited or something like that? Is there a difference in those? By the way, let me tell you, we are on Facebook Live now. Fortunately, we've been able to get there.
Good, congratulations on that. Yeah, this is where technology sometimes doesn't help us.
Yeah.
But it's good that we are able to reach out to many more people.
Yeah.
So as you asked me, what is it that makes a breast cancer feel different? And how do we understand that lump that we are feeling is a cancer or not? So the general understanding is, if there is pain, that has to be cancer. In fact, interestingly, breast cancer usually presents as a painless lump. And the feeling of an abnormal thickening or a lump in the breast is something that a woman easily picks up. And this is best understood, say, in a shower or, during when the hand is soapy. It's much easier to feel the lump oneself. So any change in the feel of a lump, any discharge in the nipple, any of these would be taken as signs of early cancer and should be checked out and should not be ignored. But the lump definitely feels hard. So there are another type which are soft lumps or firm lumps, which are like, they're very freely mobile in the breast. It just slips under the finger and you can't feel it the second time you try to check it. Such lumps may be actually benign lumps. But either ways, let the doctor decide. One should not accept it as a benign lump and sit at home because you may be missing something important.
Because, once I was in the hospital and I was trying to see in a model and I could feel the difference between a normal lump and a breast cancer lump when they were teaching me. So I was wondering whether it is always the same case or whether it happens once in a while or something like that. So
I'll tell you an example. Breast self-examination was actually thought to be an important method of detecting and screening for cancer. See, unfortunately, women themselves don't understand the lump that they feel. There is an abnormality they have picked up and that bothers them. It's an anxiety that goes up. But it's always better to get a second opinion, get a proper opinion from a physician or a surgeon, rather than trying to decide for yourself whether this lump I feel is something to worry about or not to worry about. Any lump in the breast should be checked by the doctor.
Yeah. So what is the standard treatment? Is it different for different stages? When you do chemotherapy, when you do radiation, when you do surgery, how do you decide? So what are the standard ways of treating a breast cancer?
So let's first understand that we are not trying to create a fear in the minds of people that cancer does not always mean that there is going to be a harsh treatment. But whatever is there, the treatment that is offered is essentially for becoming better and get cured of cancer. Breast cancer is one cancer that in fact has a higher chance of cure when detected early. When it is an early cancer and a small tumor, in fact, more than 90% of them get cured of cancer, which is, if you look at diseases like diabetes and hypertension, they stay with us for life. They don't get cured, you're always medicating yourself. Whereas cancer is one thing, if detected early, can be cured. So the early stages, in fact, have the modality of treatments that we use for cancer as multimodality in breast cancer. When I say multimodality, it includes surgery, It includes chemotherapy, includes radiation therapy, and sometimes hormonal therapy. So there are multiple modalities that we use. Some require only a few of these modalities, but majority may require all of them. And this is decided by the nature of the cancer. Early cancers, we treat them with surgery first. Smaller the tumor, smaller the surgery. So in fact, just having a lump does not mean that mastectomy is necessary. There can be breast conservation, just a lump being removed. And mastectomy is not necessary for all women. So earlier the cancer presents, better is the chances that the breast will be preserved, the treatment will not be intensive, and the cure will be definite.
Okay. So, what happens, why this confusion comes in that some people think the surgery is done and then maybe the chemotherapy has to be given. And some people start with chemotherapy. So the patients are, when they interact with each other, they feel that one treatment was better than the other, and especially if something goes wrong during the course of the treatment, then the anxiety is because this happened to me before, that is why it got spoiled. So why I'm asking is that there are many of us who are interacting with patients, and there are many of us who are patients themselves. So if they are clarified on this aspect, it would really help them to know that this does not make a difference or it makes a difference.
Quite true, quite true. In fact, so advising chemotherapy does not mean that one has advanced cancer. So chemotherapy is not given just because the cancer is advanced. We may start with chemo in some situations where the tumor is a little large, so that we are able to shrink it down to a smaller size and maybe offer a limited surgery. But at the same time, that's because we have a tumor that has got a higher chance of spread, and hence we want to control it by giving it earlier. Reducing the size of tumor may reduce the extent of surgery. So chemotherapy sometimes not just before surgery, we also advise it after removal of tumor. Now that is because giving chemo in this situation is also improving the chances of cure. So chemotherapy does not really mean that it's an advanced cancer. It only means that this tumor, in addition to surgery, requires some additional treatment to improve the chances of getting rid of cancer totally from the body. So chemotherapy is a must in most of the situations.
Okay. So then I wanted to know that are there too many side effects with chemotherapy?
There are some side effects, yes. There are some side effects, but that is all temporary and transient. What most women fear with chemo is the loss of hair. So chemotherapy does cause loss of hair, but interestingly, the hair loss is a temporary hair loss. As soon as the chemotherapy course gets over, hair comes back. And in fact, the hair that grows back is much better, much softer, much silkier, much more curlier. In fact, it's a kind of hair that people would have dreamed that I wish I had such thick, lovely hair. And that comes back after chemo. So surprisingly, it's a much better hair growth that happens after chemotherapy.
Yeah, I remember people looking at my hair after my chemotherapy and saying, what have you done for your hair? And I wanted to tell them that, have chemotherapy and that's the best way to get curly, black, thick
I
hair.
hope people don't take that very seriously, but yes, it does have a much better hair growth after that. The other side effects that do happen are very minor. They're like nausea, they're vomiting, but these are very temporary. Sometimes it may affect the ovarian function. So there are certain drugs that are given to protect the ovaries and so that it doesn't really. And one thing important is chemotherapy is not painful. So quite a few of them fear that chemotherapy is a very painful procedure. It's nothing. It's just medicines given. These are given through the intravenously, so or sometimes even oral, and they help to actually get rid of the cancer which has got into the bloodstream. So that way, the control of cancer is much better.
Okay. One more thing, that does having breast cancer always mean that you have to lose a breast?
Absolutely not. Absolutely not. The standard of care right now for early breast cancers is to actually conserve the breast. So there is no need to lose the breast. There are certain patients where we cannot save, but these patients can also have a breast reconstruction. The whole breast can be reconstructed using their own tissues, or sometimes using even silicone implants can be placed in, and a reconstruction can also be offered. So breast losing is definitely not a part of standard treatment for breast cancer.
So when is the breast cancer reconstruction done? Is it done at the same time as surgery or later, and how safe is it?
It can be done at the same time. So we can offer a breast reconstruction at the same time, and I think that's far better, because the woman wakes up with a breast still being there. So it's much better to do an earlier reconstruction for better quality of life. But at the same time, one can also offer them later, supposing treatment in the form of radiation and chemotherapy has to be offered, and breast reconstruction cannot be done now for some reasons. A later reconstruction is also possible, and we have done reconstruction at 6 months, a year later, 2 years later. Anytime it can be offered, there is absolutely no problem. So preferable would be an early reconstruction.
It has the same effect, like in the same prognosis, whether you do it at the time of surgery or later.
So doing a breast reconstruction does not worsen the prognosis.
Okay.
It is more for improving aesthesis and quality of life.
Okay.
So it does not cause increase in the risk for recurrence or any such thing. There is no delays in treatment. So breast reconstruction is something that's become a norm now. So majority of women who need a mastectomy for any reason can also have a breast reconstruction at the same time.
So you've answered my question, which I had in my mind, that is it like, which is better way of doing it, or whether there's more chance of recurrence if you have a plastic surgery, or whether, normal breast or surgery is what should be done and all that. So I think that answers the question that you've already, you already answered my question. Because that's what I wanted to ask, a higher risk of recurrence if breast was preserved or if reconstructed. So now there's one question that I may ask you, because if we come to it again, then it might lose the trend of my thoughts. It is that this lady is only 29 years old and has been diagnosed with triple negative breast cancer. Her mother had a history of breast cancer. She's undergoing chemotherapy with 8 chemo cycles, including a surgery. She wanted to ask what are the compulsory changes that she should follow to lead a carefree life, and does this aggressive treatment ensure that I will be cancer-free for life?
See, I may not want to discuss all details here regarding her outcome and prognosis, because I don't have a full details of her histopathology report. But yes, being a young girl, she's 29-year-old, she is also a triple negative breast cancer. Obviously, I understand she would have been advised chemotherapy for her treatment. At the age of 29, she may lose her cycles for some time, but she would regain it back. And at the end, in fact, the highest risk for recurrence is only in the first couple of years. If she has already crossed that time period, then her risk actually comes down and she can lead an absolutely normal life after that. She does need to get evaluated for genetic risk because she's young and she's got a triple negative cancer, and mother also had breast cancer. But that doesn't change anything except the fact that she has to be under proper surveillance and continue to follow up with her doctor, whoever has operated her, and stay in touch with them. And the rest of the life, as far as possible, is going to be absolutely normal. She can go back to doing her job if she was working somewhere. She can go back to her normal life and activities as she would have otherwise done.
Okay. So now, post-surgery, what is the best way of rehabilitating yourself? Like, what is the best way to look after yourself so that it's, good for your recovery and for your rehabilitation in terms of exercises, in terms of wearing prosthesis, all those things?
So immediately after surgery, we do teach them certain physical exercises. These are important. They help to actually reduce the pain that's felt after surgery. They also help to put them back to a normal daily activities. So physical exercise is a very important part of it, and arm exercises are also taught. The important thing that one must remember is two things. One is, if a mastectomy has been carried out, that means removal of the breast, the prosthesis can be used, but should be used after seroma or fluid collection has stopped and the wound has healed. So it takes about 2 weeks to maybe a month. After that, they can start using the prosthesis. And if a normal surgery has been carried out and they are in the follow-up period, physical exercise in the form of walking and keeping themselves active is very important, because losing weight and maintaining a normal body weight is very important for reducing risk for recurrence as well. So rehabilitation is not just early, but also prolonged and later. So a physical exercise being component of your recovery period is very important to keep healthy and keep fit.
Okay. So all these exercises and everything is taught to the patients soon after the surgery is done?
They are. So they're part of the rehabilitation. In fact, any breast care center would have a proper rehabilitation and physiotherapy that would be a part of this. In fact, we have a very good program that takes care not just post-operative, but starting from pre-operative, when physical exercises are taught, as well as continued on to the post-operative period, where they do these physical exercises to prevent arm edema and lymphedema. So, and also reduce the pain due to surgery. In fact, the best treatment is not painkillers, it's actually to do the physical exercises. And they're very simple and should be followed in a very regular manner.
So I don't know if you're aware, Dr. Parmar, but as a part of our project, WeCare has been giving bags for the patients so that they can carry their, all these bags where the fluids are coming out, and they can, we call them confidence bag, because a woman is able to move around with the bags, keeping her, tubes and everything in that bag. So, she doesn't have to feel that she has to stay at home and all that, and she can go. And this came out because a cousin of mine had breast cancer, and we were going to the market. That time we used to use plastic bags, and when the shop, the man said, you can't take bags inside. So she said, okay, you keep the bag. And when he saw the tubes and all, he said, no, take whatever you want. And we said, we must have bags like this so that people can identify. So you keep learning every time. Anyway, so now what I want to ask is, you've already said that breast cancer affects men also. So I think that has been taken care of. But about lymphedema, I think there's very little known about lymphedema, because there are many patients who feel that lymphedema is only when, like soon after surgery you can get it. And somebody else mentioned to me that it's a lifetime thing. So would you like to talk about lymphedema?
So let me cover both. Since you did start with cancer in men, so let me first touch on cancer in men, and then I'll move on to lymphedema. So as far as cancer in men is concerned, it is important to understand that though the incidence is not very high, so it's only about, let's put it very simply put, will be 1 in 100 would probably come, when there are 100 women, then only one man may come with the breast cancer. The treatment actually is very similar to what women go through. So the surgery is also similar. Obviously, there is no conservation here. We're talking only of mastectomy, but the treatment is going to be exactly similar to what is offered for women. And obviously, in men, one has to be clear that checking for familial risk is very important, and understanding that there can be other female members in the family who may be actually at risk and they may not have developed cancer yet. And it may be that the first person who has cancer is the male member of the family. That's one. As far as surgery is concerned, it's also similar in men. And the treatment also includes chemotherapy, radiation, hormonal therapy, as it would be for women. So there is not much of a difference there. So one must not go back thinking that men will never develop breast cancer because they don't really have a breast as such, but the breast bud is present even in males. Now, moving on to lymphedema. Lymphedema is a very scientific term, which I'm sure majority of our listeners may not be understanding. What is lymphedema? So after a breast cancer surgery, especially in maybe a couple of decades back, it was very common to see that, after a treatment of surgery followed by radiation, there would be a risk for swelling of the whole arm. Now that is what lymphedema is about. It's collection of lymph or fluid in the arm, and that limits a lot of activities in the hand and the arm, and also puts it at a risk for infection. And the infection worsens the lymphedema. So it's kind of a vicious cycle. Currently, the physical exercises that are taught after surgery themselves reduce the risk for lymphedema or swelling of the arm. In addition, there are some limited surgery that we do. So a surgery involves not just the breast, but also the draining lymph nodes in the armpit. So there are now limited special procedures called as sentinel node biopsy, where we do a limited dissection of the lymph nodes, and hence the chances of developing lymphedema comes down. And all this helps to reduce the swelling of the arm or lymphedema. The drains that are put in after surgery actually remove the fluid that collects under the flaps in the skin. So these have nothing to do with the lymphedema, but they are also draining lymph, which is nothing but body fluids. So lymphedema can be reduced significantly by adapting these methods.
And it can be lifelong. It can come up at any time, like you mentioned.
Well, if there are do's and don'ts, if there is a whole removal of all the lymph nodes has been carried out in that particular arm, in the armpit, then it is important to take care of that arm very carefully. There are lots of do's and don'ts: no cuts, no injuries to the hand, no infections, no injections, no measuring blood pressure on that arm. So there are a lot of care that has to be taken on the arm to prevent a lymphedema developing. Because once it develops, it becomes a vicious cycle. But there are methods of manual drainage of lymphedema. So these are all taught in the postoperative exercises to reduce the edema of the arm. And we have a very good program running in Tata Memorial, where there is rehabilitation and postoperative physiotherapy that is taught, with massaging of the hand and bandaging of the hand, which is also taught when there is an early signs of lymphedema. So all of these help to reduce, and lymphedema can happen anytime, not just immediately after surgery, even 10 years after surgery, if care is not taken on the arm where all lymph nodes have been removed.
That's helpful to know, because even I used to think lymphedema is only in the initial stages of the disease, and afterwards you are, like, okay. Now, another thing is that, suppose there's a young lady who's got breast cancer, and she may have been pregnant, but she didn't know. But during her pregnancy, she discovers that she's got breast cancer. What happens? Do you wait for the delivery? Do you do the cancer treatment? Can I ask all the questions related to it? Because, like, the next one, breastfeeding, is it allowed or not? And, all those questions that come up because of the anxiety of, you're pregnant. Would you terminate the pregnancy? Would you carry on the pregnancy? Would you do the treatment during the pregnancy? Or would you wait for her to deliver to do the pregnancy? And then after that, can she breastfeed?
Well, that's a whole lot of questions that gone in, but yes. Pregnancy, see, we always thought that cancer happens only in the older women, right? But we've seen that younger women in India do get cancer, and this is the prime time of their life when they're working or they're still completing their family. So there can be cancer which comes up. In fact, couple of situations, let me take them. So it could be a lady who's just got pregnant, and then she discovers a lump in the breast. Now, in that situation, there is a problem here, because we cannot delay treatment for cancer in that situation. So in the first trimester or the first 3 months of pregnancy, getting cancer is a little bit of a concern, because then the priority becomes treatment of cancer. But if cancer is detected later in the pregnancy, say 5th month or 6th month of pregnancy, and a lump is detected, it is better to immediately get it checked. Because what happens is generally the thought is that this is a milk lump. Of course, during pregnancy, milk does not form, but it is kind of related to pregnancy itself. And that is why it gets undetected or gets masked, because the changes are thought to be related to pregnancy. In this situation, it is not required to terminate or stop the pregnancy. In the first 3 months, we may require to advise termination of pregnancy, because 9 months one cannot wait for treatment of cancer. But in the middle of pregnancy, say 5th or 6th month, one can continue the pregnancy as normal and actually start treating with chemotherapy. Interestingly, chemotherapy does not affect the baby. So treatment can be started. A surgery can also be done, but radiation cannot be given. So there is always a little complexity in planning when there is a pregnancy with cancer. Now, there is no need to actually terminate pregnancy, and a full pregnancy can be completed. A healthy, normal baby can be delivered, and yet treatment can be completed. So one should not hide cancer during the pregnancy, because it just gets worse. It should be treated at the same time.
So that, I think, will be a very good message for everybody, because either you want to hide your cancer or you want to hide the fact that you're pregnant, because you don't want to lose the baby. At the same time, you don't want to have complications arising out of cancer by talking about that. So I'm glad that it can be managed. So okay, now what about breastfeeding?
Yes, what about breastfeeding? Yes. So if cancer is detected after the baby is born, right? And we start treatment, we start chemotherapy, and we start other drugs. So certain drugs that are given for treatment of cancer can pass through the milk. So we try to avoid breastfeeding in such situations. And so mother's milk cannot be given in that case, but a top feed can be given. So we try and avoid giving, especially tamoxifen, which is a hormonal tablet that we give, can actually harm the baby as well. So we avoid giving all this. Even while a person is on such medication, we tell them not to get pregnant, because the baby can be affected by treatment, hormonal treatment that is being advised for cancer. So there is effect on the baby if there is treatment that is going on later on. Also, if treatment has been given in the form of radiation, milk may not actually form, and so baby cannot be fed mother's milk in that situation. So there is certain things that need to be changed. Otherwise, rest of the care is going to be as normal as.
But suppose I have breast cancer a couple of years back, and then a late delivery happens, and then I'm not on treatment, but I have a baby. At that time, I can feed the child, right?
Yes, yes. So that is
couple of years later is okay.
As long as there is no treatment happening. So if there is no treatment that is being offered, it is safe.
Yeah.
So we try to avoid only if there is some treatment going on.
So now the interpersonal relationship, does it get affected? Because especially if it's a mastectomy, have you seen people talking about it, or saying that it is affecting their lifestyle, especially between the spouses, the problems that can come up.
Right. So as far as interpersonal relationship is concerned, one has to first understand that breast cancer is not contagious. That's the most important message. And it doesn't pass by contact. So a mother can hold a baby. The baby is not going to be getting affected because, because of her holding a baby close. Hugging does not transfer cancer to somebody else. A physical contact does not transfer cancer to somebody else. So what it really requires is the person who's going through cancer needs care, needs affection, needs that support from the family. And it is very important to give that, because it makes it easier for them to complete their treatment and go through their treatment. Normally, any treatment does not take more than 6 months. And it's very important to give that care and affection during the treatment and not to outcast them because they have cancer.
You know, we had a woman who came to us, and she had had a mastectomy. And she was told that she's going to have a mastectomy, and she was extremely worried because, she was from the rural areas, and her mother-in-law had told her that she's going to get her son remarried because she didn't want a half woman in his life. So, we don't know the emotional things that come up because of breast cancer, how people deal in every level, in every socio-economic level, from the rural to the urban. The thoughts can change, and it can be a lot of trauma for people, So, what maybe we see is one thing, and I'm sure you've gone through all these experiences with the number of years of treatment that you've done.
I think these have now, I would say a few years back, probably it was much more obvious. But people are getting more educated now, and they understand that this is as any other chronic disease. A hypertension or diabetes does not get that kind of reaction in people when it is actually a more chronic disease. But cancers are no longer a stigma now. In fact, women have had cancer and have gone back to their normal life again. And in fact, if at all, they're even more active and they are more accepted in society now. So things have changed a lot, but yes, there are certain rural areas you find there are still this kind of stories you get to hear of how a person gets, outcast because of diagnosis of cancer. But I think now it's much less to hear or to see, and it's also because people are more educated now. They feel, they have learned a lot more. There's more media involvement, and people like you and the NGOs who have been really active in propagating the knowledge of, the cancer is not a death sentence or it's not a stigma. So it can be cured, and cancer definitely can be cured, and life can be back to normal again.
So tell me something, what are the risks of cancer coming back, and does it, how can one avoid it or detect it early, or is there a particular area that breast cancer comes back in that one has to be cautious about, like the ovaries or the uterus or the lungs or the bones?
So cancer, as I've said, in the early stages, if detected, they're highly curable. But one still has to be aware of the fact that there can be a risk for recurrence, albeit small, but one has to be careful. So what does one do? First and foremost is complete your first line treatment completely as advised. No trying to avoid chemotherapy when it is required. No trying to avoid radiation when it is mandatory. So complete the first line treatment, because the best chance of cure comes out of the first line of treatment that is being offered to you. Irrespective of how harsh it may sound, but it is the best treatment. That is what ensures that the cancer does not come back. Other than that, as I've already said, physical activity and exercise is a very important component of recovery from cancer, not just in the early phase, but also in the long term. So those women who are physically active, are exercising, controlling their weight, they always have a lower risk for cancer coming back. So that is has to become an important component of your lifestyle. It has to be adopted as a lifestyle, and if followed religiously, it reduces the risk of recurrence. What makes you aware of having some kind of a worry is, but if there are certain nagging symptoms like a cough that doesn't go away, there is a body pain or backache or something that's bothering you, get yourself checked at that time, because it may be a sign of cancer coming back, but it's not necessary that all these symptoms always mean that cancer is back. The risk is smaller if it is detected early, cancer detected early, and that I will again say, the earlier a cancer is detected and treated, lower the risk of recurrence.
But even in the second time, if it is recurring, you think earlier it is better to treat? I mean, the chances of treating are better in the earlier stages?
Right. So if cancer comes back again, it can still be controlled completely, and one can go back to being a normal, healthy person again. But the chances of cure get smaller and smaller as recurrences happen. But the disease can be very well controlled and can be treated. So there is no worry there.
We need to be careful on the use of the word of control and cure. So we are controlling if it comes back and curing in the first stages, right?
That's absolutely right. Yes.
तो ये हमारा टेक्निकल जार्गन है जो हम लोग को शायद समझ में नहीं आता है उतने अच्छे से. So Dr. Parmar, in these COVID times, you must have seen a lot of anxieties related to surgery, chemotherapy, treatment should be done or not done. A lot of volunteers are not going to be able to explain things to the patients. What do you think has been the biggest challenge during COVID, and what message would you like to give to the people during this time?
Well, COVID has posed a lot of challenges for everyone. And the first and foremost, in fact, what our own experience has been is in the beginning when lockdown had started, there were a lot of concerns because one never knew in which way we were going to move. The cases were not that many, but there was always the threat that the cases would rise up very rapidly. And we could see that happening in the West with the huge numbers that were being affected. Also, one thing was clear that immunity coming down was one risk factor that would increase your risk for getting COVID. And the fear of death was always looming large with COVID infections. That's why, in fact, we've also tailored treatments during our initial months when we were seeing a few, these COVID cases coming up. In fact, chemotherapy reduces immunity, and therefore chemotherapy was being either stopped or limited in some patients. We have now realized that it's really not as worrisome as it is.
Wales visited their daughter in Australia.
Please mute yourself. Dr. Parmar, you are muted.
Okay. I just got muted on its own. So as I was saying, chemotherapy does bring the immunity down and increases the risk for infections. And COVID is also a risk that goes up. But if given under controlled environment, it is absolutely safe. And we are continuing now to give normal chemotherapy courses. Surgery, we are continuing to do. Of course, we do test for COVID before taking the patient up for surgery. And if they are COVID positive, we try to avoid surgery at that particular phase. We allow them to recover from COVID and then come back, test negative again, and then take up for surgery. And it does not seem to be impacting negatively in any manner. So in the current COVID times, yes, there have been difficulties with people unable to travel to centers to take proper cancer care. And I hope that they are reaching out to people in their local area and getting their treatment done there. We don't want cancer to become advanced while waiting for COVID to get controlled, because it looks like it's going to be on for some time. And seeing a doctor is very important even in this phase when there is a lump. Treated exactly as it would have been otherwise treated if COVID was not there.
I know we had a commitment of 1 hour from you, but taking the liberty because of the 10 minutes that we got delayed because of our issues, I want to first of all thank you for all the questions which have been answered so well and with so much of patience. I know some of the questions that we may have asked are questions which you must have thought are quite simple and silly to ask. I'm not asking you any personal questions which people have asked here, but one thing, like nowadays we get a lot of WhatsApp messages with, especially during this breast cancer awareness month, everybody becomes a doctor and keeps asking things, and like what you should eat, and this is not the right thing to eat. This can prevent breast cancer, and you do this, and breast cancer won't happen. You wear a tight bra, you wear a loose bra, or even if during periods you get those fibroids, then okay, it's fibroids, it has to be cancer. So all those type of things that come up. Would you like to talk about something about these things?
Well, there are lots of myths and there are lots of WhatsApp messages which go around, and I really want to first shoot down majority of them. So there is the usual fear saying that wearing a colored bra or wearing an underwired bra is going to increase the risk of cancer. Absolutely not. There is no such thing. Please feel good. Use whatever you want to. That does not increase the risk for cancer. Using of DO and uh, does not increase the risk for getting a breast cancer. Using hair dyes does not increase risk for breast cancer. So that's also not there. There is various other kind of rumors that go around on how cancer can be related to the color of the bra that you wear. Even that is not related. So I guess none of these really hold true. What is most important is to remember that a healthy lifestyle is very important. Maintaining a physical weight is very important. Overweight is never good. It increases the risk for cancer. Overuse of alcohol also can increase the risk for cancer in women who have a susceptibility by genetic risk. Smoking can increase the risk for breast cancer. So these are a few things that one must be kept in mind. Other than that, I think there is really, it all depends upon one's own healthy lifestyle.
Yeah, so one thing that is going on nowadays is like lot of immunity boosters. You must drink this, you must eat this is good for your health, this will prevent you, build up your immunity, a lot of things. And then when you go into these medical meetings, they say we have no conclusive proof to say that. So what's your view on that?
Well, immunity boosters have never harmed anybody as far as I see. If at all, it makes you stronger. But the best immunity is if you eat healthy. So following a healthy lifestyle, as I've said already, is the most important bit. I'm not sure about most of these immunity boosters which are available off the shelf. But yes, if you can continue to eat healthy, eat, your normal home food, even that can improve your health and immunity as such to help you fight against COVID, help you fight against cancer and any other infection. So I guess that's a universal acceptance of the fact that keeping healthy is very important.
So one last question. Because of COVID, has it got, has breast screening got affected? Because normally people would come in touch or get themselves examined. So has it affected, because, everybody's scared to touch anybody and all that. So what do you say about that?
To be very frank, we really don't know, but that's the inherent fear that we do have. There are a lot of people who have not been able to commute, to travel, to reach their healthcare centers because of the lockdown during the early part. Now, of course, movement has started, but many of the people would have stayed back, and probably time will tell us whether we start seeing more of advanced cases now after the COVID lockdown has ended. But that's one fear that we do have. And my advice to everybody would be, if there is alarm, don't fear COVID. It's not a physical contact, but as long as one maintains safety in the form of, using your mask and sanitization and maintaining that social distance, an examination, getting it done by a physician does not increase your risk for getting COVID. Visiting a hospital doesn't increase your risk for getting COVID. In fact, more infections are acquired in the community than they are in the hospital itself, because a lot of care is being taken in every healthcare center, every hospital that you go, where not just the frontline staff and the healthcare workers, everybody is taking care, both for themselves as well as for the patient. So getting COVID infection does not happen in the hospital. So please visit your doctor. Please get yourself examined. Please ensure that you start your treatment early, because if you delay, the chances of getting cured is low. The chances that you may end up with a mastectomy is much higher. It is very important that you do not ignore early signs of cancer. COVID is easier to treat. The mortality because of COVID is extremely small. And you hear that every day, even though there are so many cases that get diagnosed, the number of deaths due to COVID are very, very small. It's just a bad infection, a bad flu, which can be controlled. But if cancer delayed for too long would grow, it would affect your whole life. So I think it's very important to understand that you cannot put cancer away and treat only COVID and stay at home because of COVID, fear of COVID. Get out there, get the treatment done.
Well, all of you are going regularly to hospitals and doing your work, which itself is a very, very heartening thing. And one statement that I really liked, somebody said that we may have a, like after some time we may talk about post-COVID period, but we'll never talk about post-cancer period, because cancer will be always there. Some form of cancer will always be there. COVID may go away after some time, so we'll say kabhi COVID jaisi bimari hui thi, but we'll probably never be able to say kabhi cancer jaisi bimari hui thi. But
Absolutely. It is something
yeah,
that हाँ ये तो रहेगी रहेगी, इसको तो treat
हाँ,
करना बहुत जरूरी है.
हाँ.
That is a very important thing that we must keep in mind.
Yeah, but I mean, all of us are extremely grateful to all of you in the health community who are helping out all the patients by going to the hospital, by being with us, by talking on telephone, and putting all our anxieties at rest, which is really, really fantastic. I'm sure it's adding to your burden because आप लोगों का भी हॉस्पिटल के काम के बाद घर का भी काम रहता होगा, सब कुछ एड अप होता होगा, but never see you losing your patients. So that's fantastic. And
Yes,
so on
thank you
behalf
very
of
much
all of
for,
us, we would
yeah.
like to thank you for being with us. Thanks a lot. You were saying something, Dr. Parmar?
So it's not just us. I think it's not just the healthcare workers. We've had a lot many other lines of workers who have been working continuously all during the lockdown period. We've had the police force who have been working well.
Yes.
We've had a lot of other people who have been right there for us all the time. And I think we need to thank everybody for being there for each other. And as long as we follow our safe procedures and stay safe, I guess, everyone, we will probably be able to fight COVID much better and also treat cancer at the same time.
Thank you. Thanks a lot. I think we've all learned a lot today from all this information that you have shared with us. Thank you.
Thank you very much. Thank you.
Somebody said you doctors are angels.
Thank you very much. We are angels because you are all angels for us.
That is so true.
Thank
Thank
you.
you. Thank you.